I'm going to talk about navigating the healthcare system and life issues. So, ask for help when you need it. Don't be afraid to ask for help. Don't be afraid to stand up and be counted. Don't be afraid to have someone stand up for you if you can't do it yourself. If you have someone in the hospital and they're saying, well, they're really very sick, and then the next day someone comes in and says, we're going to discharge them to a rehab hospital. Don't be afraid to say unsafe discharge. Don't be afraid to say, I don't want to speak with a resident, I want to speak with a board-certified doctor, the hospitalist, the internist. I want to find out why there's a change and all of a sudden you're discharging them to a rehab hospital. You can use the word unsafe discharge, it just might be that. And don't be overwhelmed by your medical bills. If you're in the ER and you get the first bill at the end of the month and it says $16,000, the ER, the CAT scan, the lab tests, etc., don't freak out, don't pay a bill. Wait until you get a bill that says insurance received. And if it still doesn't look right, ask for a detailed bill. And if it still doesn't look right, you call the billing office and ask for an explanation. And if it still doesn't look right, reach out to a professional Medicare person who does billing, because sometimes what they do is if you have more than one insurance, as an example. If someone has Medicare and they have a Medigap, many times they'll bill the Medigap first and then the Medicare second, or it should be the Medicare first. I had a patient last year who spent almost 300 days in the hospital. And the number of bills that came through, 16,100, it was a $25 million bill by the time she passed away. And I can't tell you, out of 5 hospitals where she was as she progressed, how many of them billed the Medigap first and the second. And of course, the family's freaking out because they're getting all of these final notices, and I keep saying, don't worry about it. And I just keep calling Virtua, I called Camden, I called this one. I said, you gotta rebill it. This is Medicare first. The other is that you're going to probably get a call from an aunt or a neighbor or somebody who has received bills if they've been in the hospital or if they're in the hospital for a while, and they're being told that they're coming up to the end of their Medicare stay, the number of Medicare days. This is assume, and I hate the word assume, it means as you make of me, but you know, it's if you have Medicare Original A and B and not a Medicare Advantage, is that it comes through in that their secondary Medigap would pay 365 days after their Medicare days expire. So it's the idea that if Medicare approves the bill, so when you have Medicare, it's 80%, and then 20% is what you're left to pay. So that's where your Medigap would come in, or private pay. So what happens now is they approve the bill. That extra 20% would normally go to the Medigap, the secondary. They would just pay the 20%. But if your Medicare has stopped because you've reached that magic number of days, they still approve the stay in the hospital, the test, the everything. 100% of what Medicare has approved will now be paid by your secondary insurance. And again, make sure your documents are in place. I'm not going to repeat the excellent presentations, but again, 2 people on it, people you trust, people that are going to stand up and be counted for you. These are your 5 wishes. These are what I want. Do I want chest compression? Do I want a feeding tube? Do I want to be on a resuscitator for the rest of my life? Do I want a quality of life? What do I want? And the other is, make copies of your living will, make copies of the post, make copies of your medication list, put it in a Ziploc bag and put it on your refrigerator. And on it, put the name, number 1, of the person that you trust most with their phone number, and especially if that person is number 1 on the living will, and number 2, the second. Always make sure you have 2 people on there. Always make sure you have 2 people on there. So that if one person is not able to carry it out, if they're on vacation, they're in Italy, they're having a grand time, something happens, you need to be here. It doesn't matter how old we are. It doesn't matter how old we are or how old you are, because I'm old, I'm at the other end of the scale, but you're all young. You make sure you get your documents in place. You make sure, especially if you have children, you make sure that those documents are in place. What do you want for your family? If you have older parents, if you have neighbors, aunts, uncles, make sure that you're helping them get their financial documents in place. Make sure they have copies of their marriage license with a seal. Make sure there are copies of birth certificates with seals. If you work for the state and you get insurances, make sure they're in place. If you have beneficiary documents, make sure you have a file for them. These are all important documents you're going to need. And for those of you that have helped older relatives through either a death, separation, hospitalization, rehabilitation, you know how important these documents are. You make sure you have a copy of the Social Security card. It's tough today. Try going online. You can't really get online to get these things. Make sure you have copies of their Medicare cards, their health insurance cards. If you have original Medicare A, B, and D, you need a quality Medigap that pays the extras. If not, you're going to be receiving thousands of dollars of bills in unpaid bills. There are differences to tell people. There are restrictions on your Medicare Advantage. Big restrictions on Medicare Advantage. They limit the number of physical therapy, occupational therapy, speech therapy. If you're in a rehabilitation hospital, every 5 to 7 days, they're going to ask you to do a prior auth. They want another prior authorization to stay there. It is not easy. If you have someone who has Medicaid and they're not older people, they're younger people, they have to have copies of all of that with them at all times. It is not free. It's not free. It is not, quote, a free entitlement that's given. You're all working, you all pay into Social Security, you all pay into Medicare. You're all entitled to benefits. If you are disabled, you file a claim. It is not something that is free. You have earned that business, you've earned the right to receive that income. Let me just see here. Be aware of your monthly income. Go on Social Security, make yourself a portal in your name, and you'll be able to check every year the money you report in Social Security. Social Security is posted properly in your Social Security portal, so that when the time comes for y'all to retire, you know what you're going to be getting. It's a Social Security in your name. Be aware of the monthly income and your assets. There are programs now. If you know anyone that has lower income, there's something called Medicare Savings Program that reimburses Part B premium, which right now is $184 a month. So it's Medicare Savings. There's a program called SHIP, State Health Insurance Program, that have volunteers that do that. If you're eligible, have them file for food stamps, for housing, for utility, anything that can help them at their stage of their lives. Before you go to a doctor's appointment, no matter how old, write your questions down. Do not be afraid to ask questions. And I've been known to say, "Doctor, come on back. Come on back. We're not finished with you yet." No, this is not a free session. You're being paid for this. We have questions that haven't been answered. And I'll turn to my patient and I'll say, "Mrs. Jones, has the doctor answered all of your questions?" Now I know what they are because we wrote them down ahead of time. And if she turns to me and goes, "No," then I'll say, "Doctor, you forgot to say, what is the next step? What is your suggestion? How can we work on this together? But come on back." The doctor, a neurologist, I had 3 stroke patients 2 years ago, happened to be the same neurologist. The first time I came in, introduced myself to the patient. The second time I walk in with her, I'm on mine and she's on hers, and he looks at me and I could see him go, "Oh my God, she's back." With that, he got to get up and he said, "Any more questions?" And we said yes. The third time I walked in a month later with the third one, He rolled his eyes, he just sat there, he leaned against the wall, he crossed his legs, he said, I guess we're gonna have a nice chat today. I said, absolutely. And so it was, and he was much more courteous the third time around when he knew he wasn't gonna, I don't really care about 15-minute time slots. You've got the right. We talked before about, they talked before about having 1 and 2, and if you have children who are adversarial, there are signs outside the ICU that say to the effect, this is a nonviolent zone. You know, no pushing, no shoving, no shouting, no swearing, courtesy. It doesn't happen. And just recently, I was up there with a family and the wife, second marriage, and the wife, perfect control. The brother came in after 15 years of absence somewhere. He's taking over because she's not Jewish, she's Catholic, he's Jewish. And he got the doctor to talk to him. And I said to the nurse, I said, kindly go tell the doctor there's no HIPAA in place for that man. He has no standing. And I said to the wife, we can call an ethics committee. There's an ethics committee in each hospital. Because this is wrong. If you want, you can go online to get a generic HIPAA for yourself. You can put it in place for yourself, your family. If you have kids who are going off to college, please make sure you sign a HIPAA, have them sign a HIPAA for you. Because what happens is, the school is most happy to take your money, mom and dad. It happened to us. And then they turn and stand up and they'll say, but we're not gonna talk to you. Your child is now an adult. We don't have to talk to you anymore. They did that to us when our daughter was 16 in the hospital with Lyme disease and didn't want a PIC put in. Well, I said, she's 16. No, I said, oh, then good. You built her. She's now emancipated. Take us off the insurance. Well, that got a little bit of attention, but it's the idea that if your kid goes off to college, say you're here in Jersey, they're in Virginia. You have to travel to Virginia, and you get there, you don't have a piece of paper to show that doctor really who you are, and that you have the right from this child, who is now an adult, to say to you, I can talk with you. I now give my parents permission to talk to you in the event of an emergency. Also, today's environment, you're seeing more and more nurse practitioners and physician assistants, and many of them are really brilliant in their own right, but they're still not physicians, they're still not board certified physicians. So if you have a question, don't hesitate to stand up and say, you know what, I'm really appreciative that you're here, but I really need to talk to a doctor. We've been going round and round in circles, and I need a doctor. If you're lucky enough to have long-term care insurance, no matter your age, and you think that you fit the parameters of the contract, every contract is different. Every contract has different elimination days. Get that policy, get a claim filed. Get a claim filed. Yes?
I would clarify and say, talk to your elder law attorney first before filing a claim, because several policies have terms that they are triggered, and sometimes we hold off the exercise of the policy when we're in the $50 a day at home care versus $300 a day against a $555 a day retirement nursing home circumstance. So
The policy.
when we trigger the beginning of the policy is a legal decision that it wants to advise.
Yeah, and every policy is so different.
Very different.
And the amount of money is it could be $50 a day to $148 a day to $400 a day. So, and it also depends upon where you're staying, the level of care you're getting. So if your policy says up to $400 a day, and you're in assisted living and you're getting level 5, that might be $400. In New Jersey, there might be $12,000 a month. You move to Florida, the same care, the same everything, really ultra scale, it might be only $8,000 a month. That money is going to take care of you much longer. If you're in a rehab facility and have concerns, do not hesitate. If you have a loved one in a long-term care facility, a skilled nursing facility, and you have an issue, don't hesitate to reach out to the Office of Ombudsman and file a claim. Either the advocate for that facility or a state investigator or nurse investigator will come on in and take a look. I am a certified advocate for the state ombudsman office. I do have brochures if anyone has a couple extra hours a month that they'd like to volunteer in a local skilled nursing home. If you notice a tremor, please make sure someone gets to a movement disorder, swallowing, you're drowning, find a support. Be careful of the person you have going with you to the doctor's office. This is especially true when I speak with in adult groups, is that they might say, well, my neighbor's gonna go with me to the doctor's office. And what happens is the neighbor doesn't, loose lips sink ships. I think that's a favorite law. And that neighbor is not necessarily one who stays out of the local clubhouse. And that's your private business to be in that doctor's office. So some of these communities have sign-up sheets that we have somebody that'll take you to the doctors. Happened right now in Carefree in Holiday City. And one of my people called me and said, Stevie, this nice young man called from the clubhouse and he said that they're doing, driving me to the doctors, and isn't that nice? And I said, what'd you tell him? She said, I told him absolutely not, because he wanted to go in with me. And I said, that's good. She's 92 with everything there. But that's scary if they're calling different people in the community and saying, I'm calling from the clubhouse. And he's a realtor, he's starting out, local. So be careful. Never hire a caregiver from the Montans. You want only, and I know we have two caregivers here. Never, ever, ever hire an independent caregiver unless you're willing to step up to the plate, give them a 1099 reportable income, or set yourself up as an employer, and you're paying taxes for them, Social Security, withholding disability, they're paying their own and reporting their own taxes. Slips and falls, they can own your house. They can own you. They can own everybody. Certified home health agency is licensed. We're in Jersey. They background check, they fingerprint. They're certified home health aides. They're licensed. I have somebody in Texas, and I'm going through that now, and I'm saying, oh my God, Texas doesn't license them. Oh, don't worry, we do background checks. How about fingerprint? No, we only have to do this, this, and this. New Jersey, it's fairly strict. And you don't want somebody who is just, my neighbor down the street said she'd sit here and do it and give them a shower and everything else. Again, loose lips, not under control. And as you all know, everybody has cell phones now, most everybody. But the important thing is life alerts. If you have anyone at home, no matter what their age, if they're disabled, to have a life alert, a pendant that they wear. Most of us are wearing Apple Watches. They do have fall alerts. Very important. If you know someone, Caregivers of Central Jersey actually gives out free Sky Angels. Ocean County Social Services gives out free Sky Angels as well. And I just want to tell you, on my tombstone, I always said the family joke after my mom first. My mom always made it work. And then I would always make it work. And that was always it. And I decided a little bit ago that I really was going to change the wording on my tombstone to say, I am here because my daughter texted and didn't call. We all have dysfunctional families. It's sort of a fact of life. And if you go back to whenever, and somebody moved away from home, I can picture my grandmother telling my mother, we lived 20 miles away maybe, Madeline, you didn't come to see me, but we were there every Sunday for dinner. And so my mom, I could figure I was 75 miles away. And so instead of calling, everybody texts. Everybody texts, it's the way to do it. But just don't hesitate to pick up the phone and call somebody you love every so often. It's that personal connection. It's the idea that you're taking the time to call and say, how are you doing today? I can't be there to hold your hand, but I'd really like to be. And it's the personal connection that we all need. And that, I think, ties into the paperwork that we all need. It ties into you're in business. If you're getting a salary, put your money away. Make sure you get the benefits. If you can't do it, there are ways to get the benefits for long-term care, There are policies today where you can get a whole life policy that the interest is going to pay for the long-term care policy. Do it for yourself, because we don't know what the future holds. We don't know how it circles back. And we all know, you're all this sandwich generation. My generation was first. There were my parents and there was our daughter. So you're all more in tune with that now. It's part of a fact of life. So just ask questions. Don't hesitate to ask questions. Don't hesitate to ask somebody for some help. Don't ever hesitate. Anybody who's worth it will just give it to you. So we're here. Great. There are brochures in the back on the polls. Please take it. I always have to say, volunteers are always welcome. And advance directive in the polls. There's a little brochure on that. And there's actually the polls. A Ziploc bag on your refrigerator, a magic marker with the name and phone number of number 1 and number 2 people. And again, it's not the kid who's number 1 in line in your family. Just make sure it's the person who's going to follow your wishes. They're called My 5 Wishes. What do you want for your life? What do you want for your life? How do you want it? What decisions do you want made for you? And you have that, even if it's somebody who's not your family. So anyway, thank you.